I think there are a lot of myths around the Portuguese model that, for instance, we just liberalize, you do whatever you want, nobody cares, you have your individual freedom, you have all the room to develop the kind of behavior that you wish. That's not the case. It's important to say that using drugs in Portugal is still prohibited, punished under the administrative law. So there's a clear sign of disapproval of our society to the use of drugs. We do not incentivize, we do not normalize the use of drugs.
If somebody in Portugal starts injecting heroin in public, what would happen to them?
Would be arrested. He would be conducted to the police station. The substance or substances would be apprehended, and if he or she has more than the amount that is established by law in a table with different amounts for different substances, if he has more than the amount that is calculated on the basis of personal use for 10 days, he undergoes criminal procedures as before. Okay? If he has less than that amount, he would be intimated to present himself to the Commission for Dissuasion of Drug Addiction. In maximum 3 days, it's not a court, it's not a formal instance, but you will be confronted to discuss his drug use with health professionals. It's mandatory. It's a kind of indicated prevention tool that we have. We can reach people that otherwise we never meet, we never interact with. Okay? So with a little bit of muscle, I would say, you have them in front of you. And then you can discuss. We can try to understand what is happening with this person. Okay? I must say that hopefully on each 100 people that is conducted to those commissions, 10 of them are problematic users. The other 90 are not problematic, occasional recreational users of cannabis or other substances, but without the compulsivity to use it every day, every hour. 10% will be addicted, okay? And then they may be invited. As you come to a diagnosis of problematic use, addiction, you may invite this person. Have you ever thought about searching for a treatment, joining a treatment facility? And people would say, oh yes, in the past I have, or no, I thought about that, but it's so complicated to go there to... You think so? Would you like? Do you want to start a treatment or to join a treatment facility? I can phone call, Dr. X, I have a client for you tomorrow, 10 o'clock, the day after tomorrow. Okay, does it fit you? In 2 days, you have an appointment at the Center X for free, without cost and without bureaucracy. You can start. I'm not saying that they are going to be successful, but they have a door open and they know, and most of them, I would say 90% of them, go there to the first appointment, okay? Even if the thing does not work in this first contact, okay, but the door is there. And the reference professional, psychiatrist, psychologist, whatever, is in his end to whenever he wants. But from the 90% that are not problematic users, even then, and this is the big investment that we have, those 90%, I smoke, I have no problems with drugs. I smoke a joint on weekends with my friends or when we go to the disco. But in that discussion, you see, my parents are divorcing, or my father just lost his job, or myself, I have facing some difficulties with my gender choices or whatever. No? Would you like to discuss it with a professional? Would you like to have, not the drugs issue, would you like to discuss those social difficulties you are living at home, or your psychological difficulties that you are facing? Would you like to have someone? I also can address you to a consultation of a psychologist for free, anonymous. You don't even need to tell your father, your mother, you are attending those. And with that, the aim is to interrupt a career of sporadic drug use, whatever, that along with those difficulties may lead the person to a more problematic use later on.
It seems to me that Portugal is engaging in what I would define as some amount of significantly greater coercion.
As I said, there's a social pressure against some behaviors. Okay, we are quite conservative, but in the on another way, the family traditional values are very present in our society, and family pressure in any way is really, and family solidarity is also present. People go until the limit. Okay, people give everything they have and they do not have to help and support their relatives. Sometimes they give much more than what we would recommend. Okay, you have to protect yourself as well, because when you have these kind of problems in a family, it's all the family that is in fact suffering for addiction and dependence. So this is, in my view, this is what really makes the difference. Even here at European level, you can find a similar approach in the countries of the South, but which is clearly different from what in northern countries. It's a matter of culture, matter of the Latin way of living that distinguishes really.
Can you describe in particular that's the open drug scene?
The biggest supermarket of drugs in Portugal, the entry point for illicit substances for all the territory of Portugal. And it was visited every day by thousands of people from all over the country. And some of them started to use there. Okay? Put tents that were injecting rooms. And the amount of people that joined there became huge.
Mm.
Okay? Every day, every morning, you could find dead bodies around with overdoses. Then the municipality in 97, 98, the municipality of Lisbon decided to end this, to clean it. And then the mayor alerted us, okay, I am going to put the bulldozers on and clean all the area and put these people out of there with the police. And I and my minister, we negotiated with the mayor that, okay, give us 3 or 4 days. We have to prepare to deal with all those people, with those homeless, of all those disorganized people that are there. We have to put together some responses for them. And in 3 days, with the help of the army, we organized an emergency shelter for those in need of that, with some containers to offer medical care. We have put together an emergency methadone program for them, an emergency program with food and showers and the basic needs for those people. We screen them for tuberculosis, for HIV, for hepatitis. Instead of having thousands of people concentrated in one place, we could reach them more easily in smaller communities with the intervention of street teams, the installation of shelters, aware that people who do not have the fulfillment of their basic needs, we cannot just appeal to their willingness to stop. And there's a clear disapproval of the society to the use. We resist to normalization of drug use, okay? But when it happens, okay, we are there to treat. We try to give a clear sign of disapproval to that behavior, but not differently from what happens with illicit drugs. Decriminalization is only one aspect of it, and its importance comes from the fact that it introduces coherency in all the system. Because if we deal with those problems as health and social problems, how could we keep the criminalization